is Stephen Vegas with LiveInsuranceNews.com bringing you the major headlines from this week in insurance news. Health insurance navigators targeted by new federal rule. In order to address one of the many concerns that states are having regarding some of the health insurance provisions of the Affordable Care Act, the Department of Health and Human Services has issued a new rule concerning the use of health insurance navigators. Navigators are meant to help consumers find the best coverage available to them through state or federally run health insurance exchanges. The new rule introduced by the HHS declares that these navigators must be volunteers rather than formal employees. Illinois looks to raise awareness of health insurance exchange. Illinois has received a $115 million federal grant designed to help the state build and promote a functioning health insurance exchange. The problem, however, is that there is still a great deal of uncertainty among Illinois residents concerning their eligibility for the exchange and the subsidies being provided by the federal government for coverage. The state will be using some of the money it has received to launch a marketing campaign in order to raise awareness of the exchange among consumers. Renters insurance is still battling with consumer misunderstandings in Atlanta. Insurance statistics show that a growing number of Americans are not protecting themselves through renters insurance coverage. Experts suggest that many Americans misunderstand the costs associated with renters insurance, thus are driven away from the coverage due to the idea that it is a financial burden. Statistics show that confusion regarding renters insurance is especially high in Atlanta, Georgia, as well as other large cities throughout the country. A federal health insurance program is in danger of running out of funding. The pre-existing condition insurance program is in danger of running out of funds due to legislative oversight in the Affordable Care Act. The federal health care law has attributed $5 billion to the program, which critics claim is simply not enough to cover the program's costs. The health insurance program may actually require more than $30 billion in federal funding in order to accomplish its goal of providing coverage to those with pre-existing medical conditions. Insurance news from the Northern Gateway Project reveals that $1 billion of coverage is needed. Canada's Northern Gateway Project has been causing a stir in the insurance industry due to the costs associated with covering the pipelines of the project. Coverage for the entirety of the project is estimated to be more than $1 billion, making it a costly venture for any insurance provider. That's it for this week's news roundup. Be sure to visit LiveInsuranceNews.com for active coverage of the issues that matter to you.